7 News on your side at 4 starts now.
Right now, there is a growing effort on Capitol Hill to provide first responders with mental health support. It's an issue that the organization Volunteers of America is working to tackle.
And the VOA developed the Rest for First Responders program to help get police officers, firefighters, and EMTs the help they need. And joining us live right now to talk about it is the doctor who founded the program. Dr. Rita Brock is the director of the Shea Moral Injury Center of Volunteers of America. And Dr. Brock, thank you for joining us. And just first, this isn't the first time this effort to support first responders has been talked about on the Hill. Why is the timing of this so important?
Well, I think we've just been through a very difficult period in our country's history around the strain on first responders, not only because of the pandemic, but because of all the shootings and the polarizations in the society that has heightened in some cases, the dangerousness of the work, but also just the load that first responders are carrying. It's just been a magnitude much worse, I think, than 3 years ago.
Yeah, and you make that reference to 3 years ago with the pandemic. What has the shift been? What are some of the new problems now facing first responders?
Well, I think that they share the sense that for so long their whole work has been protecting and saving lives, and then there's long periods where they haven't been able to save anyone. And that's just devastating when that's your whole work. I mean, one of the first deaths by suicide in April of 2020 was a rookie first responder, and he told a friend, he said, all I'm doing is finding dead people. And he was just really discouraged. And you know, you don't get any wins, it's all losses, and that's just devastating to people who really are dedicated to that kind of work.
And doctor, aside from the physical dangers and realities that these first responders face, there's unseen challenges, as you mentioned. PTSD might be the first thing that comes to mind, but you say it's more than that as well. What does your research show?
Well, the fact is that, first of all, moral injury is not a disorder. PTSD actually is a mental health thing that can be addressed with protocols and be helpful to people. But moral injury is a normal moral response to devastating conditions where your conscience starts to bother you because either you might be upset about what someone else did, or you might even be upset with yourself for what you did, or the conditions make you feel like you're a failure. And that's not a disorder, it's a normal response, and yet it's an awful kind of moral suffering. It's an inner anguish, and there are ways to address it. That's what we're working on.
And you mentioned the impact that the surge in crime is also having on first responders. I've been in conversation with some of the local surgeons and healthcare workers about that very point. Can you talk to me about how those events where we have this cycle of violence impacting especially our young people, how it's impacting healthcare workers?
Sure. Well, especially the first responders who have to come upon a scene and they're going there hoping to save people, and all they can find is dead children. I cannot even imagine what that must be like, especially if they have children themselves. And that's the kind of thing that bothers you morally. Who could do this and do this to little kids? And are your own children safe? You might start worrying about that as well. So there are things like that. And the desire to save people is fierce, and when you can't, it's really devastating.
And doctor, in our area, you know, so many first responders who might need these resources and help. Can you recommend any resources for those in our area who might be struggling right now?
Well, our program, which is called restforfirstresponders.com, you go to that and you can find it online. It's an hour online with other first responders. It's facilitated by first responders, so people who will understand what you've been through and support you through the process of expressing your feelings and trying to get a handle on what's been going on with you. And it's free, it's open to the public and to first responders, and it's available online. So it's also confidential. People don't have to know you went in there to use it. And if you're just feeling miserable inside, it's a great way to connect with others who will support you and make you feel better.
Well, Dr. Brock, we thank you so much for the work that you are doing through Volunteers of America and the impact you're making. This is such critical work, especially at this time.
Well, thank you for having me. And that URL is and then the number 4, rest4, firstresponders.com.
All right, got it. We'll post it on our website as well. Thank you again.